Today we're going to talk about preventing infection, which is chapter 16 in your textbook. An infection is a disease state resulting from the invasion and growth of microbes in the body. A local infection is isolated to a body part. A systemic infection involves the entire body. Common sites for infection include the respiratory system, urinary system, blood, breaks in the skin, and the urinary tract. Infants, older persons, and disabled persons are at increased risk for infection. The goal of infection control is to protect patients, residents, visitors, and staff from infection. The body has both external and internal defenses against infection. External defenses include the skin, mucous membranes, hair in the nose and ears, and good hygiene. Internal defenses refer to the immune response. So blood will go to the area to clean away pathogens. That results in erythema, edema, and warmth. White blood cells will attack the pathogens, which results in pus. And an increased body temperature or fever helps to destroy the pathogens. Antibodies are special proteins created by previous exposure to the pathogens. They also can be created by vaccination. Once created, the body will attack new pathogens that enter the body. Early signs of infection include feeling unwell, sore throat, coughing, fever, chills, nausea, diarrhea, or drainage from a skin wound. It's important that the CNA report these to the RN. Other signs and symptoms of infection are tachycardia, tachypnea, pain, fatigue, loss of appetite, rash, sores on mucous membranes, heat or warmth on a body part, confusion, muscle aches, and joint pain. As people age, the immune system declines, which increases a person's risk for infection. An older person may not show the typical signs and symptoms of infection. He or she may have a slight fever or no fever at all. Redness and swelling may be slight. The person may not complain of pain. Confusion may occur. For example, a UTI in an older person often presents as confusion. Infections can be life-threatening before the older person shows any signs or symptoms. The CNA should report minor changes in a patient's condition to the RN. Healing also takes longer in an older person. Older individuals have thinner skin, which makes them more susceptible to tears. Limited mobility increases the risk for pressure injuries. Skin tears and pressure injuries are a risk factor for infection. Decreased circulation in the elderly slows the response of blood to an infection and slows wound healing. Dehydration increases the risk of infection. Malnutrition decreases the body's defense mechanisms against pathogens. Microorganisms are small, living things only seen with a microscope. They're also known as microbes or germs. Pathogens are microbes that are harmful and can cause infection. Non-pathogens are microbes that do not usually cause an infection. Bacteria are one-celled organisms that multiply rapidly. They can cause an infection in any body system. For instance, E. coli is a bacteria that can cause a urinary tract infection. Fungus are plant-like organisms that live on other plants or animals. Mushrooms, yeast, and mold are common. Fungus can infect the mouth, vagina, skin, feet, and other body areas. For instance, yeast infections, athlete's foot, and ringworm are common fungal infections. Protozoa are one-celled animals. They can infect the blood, brain, intestines, and other body areas. Rickettsia is found in fleas, ticks, lice, and other insects. They are spread to humans by insect bites. For instance, Rocky Mountain spotted fever. Viruses grow in living cells. They cause many diseases, including the flu, the common cold, herpes, AIDS, and hepatitis. The flu vaccine is a good preventative measure. The norovirus is an example of a very contagious GI virus. Microbes need a reservoir to survive. The reservoir is the place where a microbe lives and grows. People, plants, animals, soil, food, and water are common reservoirs. Microbes get water and nourishment, two other things they need to survive, from the reservoir. Microbes also need a warm, dark environment, most need oxygen, and most grow best at body temperature. Microbes are destroyed by heat and light. Some factors that contribute to infection are the number of pathogens present in the environment, the virulence of an organism, the susceptibility of the host, and environmental factors. Susceptibility of the host refers to age, illness, chronic disease, poor nutrition, poor hygiene, stress, and fatigue. Environmental factors include food, moisture, warm temperature, and darkness. Severe infections can be deadly for burn patients, transplant patients, and chemotherapy patients. Burns destroy the skin, providing a portal of entry for microbes. Microbes are from the person's normal flora, the healthcare setting, and the health team. Burns also affect the immune system. A transplant involves transferring an organ or tissue from one person to another person. To the immune system, the new organ or tissue is a foreign object. The body's normal immune response is to reject the new organ or tissue. Drugs are given to prevent rejection, which suppresses the immune system. Some chemotherapy drugs affect the production of white blood cells, which are needed to fight infection. Normal flora refers to microbes that live and grow in certain areas. They are non-pathogens when in or on a natural reservoir. For example, E. coli is normally in the colon where it does not cause infection. When it enters the urinary system, it will cause infection. Multi-drug resistant organisms are microbes that can resist the effect of antibiotics. It's caused by overprescribing antibiotics, and examples include MRSA and VRE. MRSA is found in the nose and on the skin. MRSA is resistant to antibiotics often used for staph infections. MRSA can cause serious wound and bloodstream infections and pneumonia. VRE refers to vancomycin-resistant enterococcus. Enterococcus is found in the intestines and in the feces. It can be transmitted to others by contaminated hands, toilet seats, and care equipment. When not in the intestine, enterococci can cause urinary tract, wound, pelvic, and other infections. The chain of infection describes how microorganisms are transplanted from one person or place to another person or place. The source is the pathogen. The reservoir is where the pathogen grows and multiplies. The portal of exit is the way the pathogen leaves the reservoir. Exits are the respiratory, gastrointestinal, urinary, and reproductive tracts. Breaks in the skin and the blood are also portals of exit. The method of transmission is how the pathogen spreads. The pathogen is transmitted to another host. A vehicle is any substance that transmits microbes. The portal of entry is where the pathogen enters the body. The portals of entry and exit are the same. The susceptible host is the person infected. The transmitted microbe needs a host where it can grow and multiply. Susceptible hosts are at risk for infection. Susceptible hosts includes persons who are very young, are old, are ill, were exposed to the pathogen, and those who do not practice measures to prevent infection. This picture here shows the chain of infection again. It shows each different link in the chain with examples. This picture here is another picture of the chain of infection. And again, it shows each specific link in the chain of infection with examples. Humans can cause infections by not washing their hands after going to the bathroom, by coughing or sneezing into their hands, and by poor hygiene. Animals can cause infection through fecal contamination, deer ticks, mosquitoes, and meat that is not prepared to the proper temperature. Environmental sources for infection include contaminated water or food. Some methods of transmitting microbes are through blood, bodily fluids, secretions and excretions, animals, insects, wound dressings, direct contact with an infected individual, personal care items, eating and drinking utensils, water, food, the air, and coughing, sneezing, talking, laughing, and singing. A carrier is a human or animal that is a reservoir for microbes but does not develop an infection. Carriers can pass pathogens to others. A vector is a carrier that transmits disease. Common vectors are dogs, mosquitoes, ticks, and mites. A healthcare-associated infection is an infection that develops in a person cared for in any setting where healthcare is given. Common sites are the urinary system, respiratory system, wounds and surgical sites, and the bloodstream. It's also known as a nosocomial infection. Bloodborne pathogens are pathogens present in human blood that can cause disease in humans. Examples include hepatitis B and HIV. The term blood refers to human blood components, and products made from human blood. Contaminated means the presence or anticipated presence of blood on an item or surface. Contaminated laundry is laundry soiled with blood or laundry that may contain sharps. Contaminated sharps are any contaminated object that can open the skin, needles, scalpels, broken glass, etc. Do not throw loose needles, syringes, or sharps into the trash or recycling bin. Do not flush them down the toilet. Put them in a commercial or household sharps container. Decontamination is the use of physical or chemical means to remove and activate or destroy bloodborne pathogens on a surface or item. Contaminated equipment and work surfaces are cleaned and decontaminated with a proper disinfectant after completing tasks, anytime there is an obvious contamination, and at the end of a work shift. Engineering controls are controls that isolate or remove the bloodborne pathogen hazard from the workplace. For instance, the sharps disposal containers or self-sheathing needles. An exposure incident is eye, mouth, or other mucous membrane or non-intact skin contact with blood that results from an employee's duties. An occupational exposure is reasonably anticipated skin, eye, or mucous membrane contact with blood that may result from an employee's duties. Other potentially infectious materials include human body fluids, any tissue or organ from a human other than intact skin, HIV-containing cell or tissue cultures, organ cultures, and HIV or hepatitis B containing culture medium or other solutions. Piercing mucous membranes through the skin, needle sticks, human bites, cuts, abrasions, or others are parental exposures. Personal protective equipment is the clothing or equipment worn by staff for protection against a hazard. For instance, gloves, goggles, face shields, masks, shoe covers, and surgical caps. Regulated waste is closable, puncture-resistant, leak-proof containers color-coded in red with the biohazard symbol. The source individual is any person, living or dead, whose blood or other potentially hazardous material may be a source of exposure to staff. Finally, workplace controls are controls that reduce the likelihood of exposure by limiting splatters, splashes, and sprays. Producing droplets is also avoided. A biohazard bag, like what's in the picture, is used to dispose of infectious waste. Infectious waste is waste that's contaminated with blood or body fluids. Biohazard bags are red bags. They're not disposed of with the ordinary trash, and they must be incinerated. An exposure incident is any eye, mouth, or other mucous membrane, non-intact skin, or parental contact with blood or infectious material. Causes include needle sticks, human bites, cuts, and abrasions. The CNA should report incidents at once. Asepsis is the absence of disease-producing microbes. Medical asepsis, or clean technique, refers to practices used to reduce the number of microbes and prevent microbes from spreading from one person or place to another person or place. Surgical asepsis is the practice used to remove all microbes, both pathogens and non-pathogens. It's required anytime the skin or sterile tissues are entered. Surgery and labor and delivery areas require surgical asepsis. Sterilization is the process of destroying all microbes. The word sterile means the absence of all microbes. A sterile field is a work area free of all pathogens and non-pathogens. Sterile procedures are typically nursing responsibilities, but some states allow them to be delegated. Sterile gloves are single use. Once they are on, you can only touch things in the sterile field. Contamination is the process of becoming unclean. Cross-contamination is passing microbes from one person to another by contaminated hands, equipment, or supplies. Common aseptic practices include hand hygiene, providing patients with their own personal items, bathing, washing hair, and brushing teeth regularly, washing fruits and vegetables, washing cooking and eating utensils with soap and water after each use. Medical asepsis reduces the number of pathogens. It's referred to as clean technique, and it's used in the administration of medications and daily hygiene. Some guidelines for preventing infection in a facility are: never share a resident's personal items with another resident, never transfer personal items or equipment between rooms, hold equipment, personal care items, and soiled laundry or linens away from the uniform, do not use equipment that has been dropped on the floor, clean all equipment after use, clean common areas, remove food and utensils from the resident's room, change and date water cups often, never place contaminated items on overbed tables, and when cleaning, move from the cleanest area to the dirtiest area. When doing laundry, it's important to handle linen in a way to prevent exposure to urine and stool. Handle linen in a way to prevent the spread of infection. You want to store and transport linen properly. CNA personal hygiene. Wear a clean uniform each day. If you are ill, do not come to work. Keep hair pulled back and secured. And follow the facility policy for nails and jewelry.